Hello, everyone, and welcome. Thank you for joining us today for another episode of our Facebook Live conversation. My name is Marian Tabi, and I'm speaking to you today from Congo Brazzaville, here at the WHO Regional Office for Africa. Today, we will be discussing on a very important topic, one that touches millions in Africa: diabetes. And joining me today to discuss this important topic is Dr. Gonzi Shizimogo. She is a medical officer in charge of non-communicable diseases at the WHO Regional Office for Africa. Hello, Dr. Gonzi.
Hello.
Welcome.
Maria. Thank you so much.
So, Dr. Gonzi, can you start by explaining to our viewers what is diabetes?
Okay, thank you, Maria. And in simple terms, I would say diabetes is a chronic or lifelong condition where the body is not able to regulate or control blood glucose. This happens mainly because either the body is not able to produce the hormone called insulin, or the body is producing the hormone called insulin but is not able to use, like the home is not working very well. And the insulin, I would say, it's a sort of like a chemical messenger that acts like a key to let the sugar into the blood so that it can be used for energy.
Okay, thank you so much, Dr. Gonzi. We often hear of type 1, type 2, and also gestational diabetes. Can you explain the difference between these three?
Yeah, thank you for that question. Type 1, I'll start with type 1 diabetes. Type 1 diabetes, it's usually starts during childhood or during adolescence, and this is the type where the body is not able to produce the hormone insulin because the immune system is like attacking the part of the body that produces that insulin. So people with type 1 diabetes, they need to be given insulin for the rest of their life in order for them to survive. And is the least common type of diabetes. And then type 2 diabetes, this one is the most common one, and it usually happens during adulthood. But these days we do see even young adults or adolescents having type 2 diabetes because of these lifestyle changes. And type 2 diabetes, it happens when the body is producing that insulin but is not able to use it very well, and is the most common type of insulin is the most common type of diabetes. And then we have gestational diabetes. Gestational diabetes usually happens during pregnancy, and it usually goes away after delivery. But the most important thing about gestational diabetes is that if you had gestational diabetes, it actually increases your risk of developing diabetes in your lifetime. So that is why it's very important for those who had gestational diabetes to screen on a regular basis, so that, if in the event that they will have diabetes, it can be caught at an earlier stage.
Wow, thank you so much, Dr. Gonzi. So moving on, can you explain what are some of the risk factors contributing to type 2 diabetes?
Okay, yeah. I think before I talk to the risk factors, I want to just maybe highlight one thing. Type 1 diabetes cannot be prevented, and then type 2 diabetes can be prevented. So when we are talking about now these risk factors, we mainly focusing on those risk factors that increases your risk of developing type 2 diabetes. So what happens is there are two types of risk factors: those that we can change and those that we cannot change. I want to say this because I'll use that maybe also to differentiate in terms of maybe what we can do to prevent ourselves from getting diabetes. So those that we cannot change are your family history. Maybe if one of your parents has diabetes, it increases your risk of developing diabetes. And then we also have age. It increases with age. And then those that we can control, what is normally called modifiable risk factors. So those that put you at risk, we have being overweight or obese, unhealthy diets, like diets that are very high in sugar and processed foods. And then we have also alcohol use. We have smoking, tobacco smoking as well, and physical inactivity. So these are some of the things that can put you at risk of developing diabetes. And lack of sleep. Lack of sleep. Sleep is important.
All right. I mean, that moves us to our next question that is we often see this question from the public. Can one avoid getting diabetes? How can one avoid getting diabetes?
Okay, diabetes, like we said, they are preventable. I mean, there are risk factors that you can change and those that you cannot change. Unfortunately, for type 1, you can't really avoid it because that one is like, it's a sort of like an autoimmune disease. Something is attacking your own cells. But for type 2 diabetes, you can focus on things that you can change. Lifestyle modification. Aim for a healthy lifestyle. And when you talk about healthy lifestyle, we are basically saying maintain a healthy weight. Increase your physical activity. The recommendation is just simple. It's at least 30 minutes for a minimum of 5 times a week. And then we are also saying if you are drinking alcohol, please try to avoid alcohol or reduce the harmful use of alcohol. Tobacco smoking, also stop smoking and get adequate sleep. So these are some of the things that you can do. And I think I want to plea and say every small effort actually makes a big impact in the long run.
All right. Thank you so much, Dr. Gonsi. Moving on, are there treatment options for diabetes? Type 1, type 2, are there treatment options?
Luckily, yes, there are treatment options for diabetes, all types of diabetes. There are treatments that are available, and the good thing is diabetes can be very well managed. So for type 1 diabetes, because I had previously said is the main problem is they don't make insulin. So it means they'll need to be given insulin for the rest of their life. And they need that insulin to survive. So it's very, very important. That's type 1. And then for type 2 diabetes, because we keep on talking about things that can put you at risk of developing diabetes, I'll say the number one ways of controlling your diabetes, type 2 diabetes, I'll say is lifestyle modification. Just maintain a healthy lifestyle. I've already talked about it. And then in terms of medication, we have oral medications or your pills or your tablets, and then we also have the insulin as well. So type 2 diabetes, you can either be given pills only, or you can also be given pills and insulin as well, depending on how your disease progresses and what your clinician or healthcare worker, recommends. Yes.
Thank you so much. I mean, you've spoken of maintaining a healthy weight and also medications in terms of treatment options. That brings us to WHO. There is this weight loss medication that people usually take, and as an expert with WHO, what is WHO guidelines on the use of diabetes medication for weight loss?
That's an important question, and I believe our audience will also like it. In 2025, WHO released its first global guidelines on the use of diabetes medication to manage obesity. Yeah. So these medications, I think they're called a group of, just the class name is called, they are called glucagon-like peptides, or GLP-1 for short. These were the medications that have been used to treat diabetes, but then now they're being used to manage obesity, because obesity is now being classified as a chronic condition as well. So then even though these medications are now approved to be used for obesity, they should not substitute your healthy lifestyle.
Yeah.
They should also be used under medical supervision. And you should do that under medical supervision together with your healthy lifestyle. Don't just say, I'm taking this medication, now I'm not going to be bothering myself with exercise or with healthy lifestyle. You have to continue doing both. So that is the message that I can say. You need those medications, you are taking those medications, but you still need to maintain a healthy lifestyle.
Okay, thank you so much. Now, how can people support someone living with diabetes in terms of support mechanisms? What would you recommend?
I think that's a very important question because, you know, diabetes is a chronic condition. It's a lifelong disease. And we know that with lifelong conditions, you can also have other, especially emotional issues. So I think the main thing is let's support them emotionally, offer emotional support because living with a chronic condition can cause stress as well, or even depression for some. And then also encourage them and don't criticize. And now, because we talked about these factors that can help you reduce your chances of developing diabetes, I think it's important to do that as a family. It's important to exercise together. It's important to eat a healthy diet together. And I think in terms of diet, I want to highlight that sometimes when you are living with a person with diabetes, time and again, people use, like, they cook 2 meals, one for the rest of the family and then one for diabetes. I want to say there's nothing like a diabetes diet. Okay. That same diet is actually important. It's actually good for the whole family. So it's what all of us should be eating, not just saying this is for a person with diabetes, because when you compare, you realize that you are giving that person a very balanced, healthy diet, and then the rest of family is eating something else. Most of the time, not good, high in processed food, sugars, and all that. And then another thing is help them in terms of medication adherence. Taking medication for the rest of your life could be a challenge, so it's good to just support them, help them in terms of reminders so that they don't forget. Go with them to the clinic for checkups if possible. So I think that's what we can do, because if you are supporting each other, if you are supporting the person living with diabetes, even in terms of their control, it gets better because we have support.
Thank you so much for that. Now, you are a medical officer in charge of non-communicable disease here at the WHO Regional Office for Africa. Can you tell us what WHO is doing with countries to reduce diabetes cases in the region?
Okay, WHO is doing quite a lot in terms of supporting countries to address the rising burden of diabetes. And I think one important thing is supporting countries to strengthen the primary care level in order to respond for this higher burden of diabetes. And they're doing that through implementation of initiatives such as what you normally call the WHO PEN, as well as the PEN Plus. These are basically just integrating NCD care together with diabetes into the primary care level. And then also they supporting countries also in terms of capacity building or training of healthcare workers. They're also developing guidelines, norms and standards. And the guidelines are very important because they standardize the management and make sure that patients or people living with diabetes are managed as per the guidelines. And also even public education or public awareness through commemorations of days like World Diabetes Day. And even just what we are doing right now is raising awareness on diabetes. So these are some of the things that WHO is doing to support member states, plus many.
So tell us, Dr. Konsi, what are some of the misconceptions about diabetes that you would love to clear today?
Okay, I think there are quite a number of misconceptions and myths regarding diabetes, and one I'll just maybe mention maybe two or three. I think the first one is diabetes only affects rich people, but I think the fact is diabetes affects anyone from all levels, all income levels. We have people with diabetes in poor rural areas, so diabetes is not limited to maybe high income countries or rich people. And then secondly, traditional herbal remedies can cure diabetes. Currently, there is no cure for diabetes, and it's very dangerous for one to stop medication and then rely on these traditional herbal medications. And another myth is only overweight people do have diabetes, but the truth is we even have people who have there are other people with diabetes regardless of their body weight, because like I was saying, there are many players in terms of things that can increase your risk for having diabetes.
Yeah.
You know, some of them, yes, their lifestyle, some of them their genetics, some of them is environment and all that. So don't just say I don't have this and I won't have diabetes. So I think these are those three that I want to address, even though there are quite more.
Thank you so much, Dr. Gonzi. We are almost coming to the end of our conversation, but I don't want to close this without giving you the opportunity to be able to give out a message out there to someone watching us right now. What is your one key take home that you want people to know about diabetes in Africa?
I think the message that I want to say in terms of diabetes in general, I want to say that diabetes is rising, but it can be prevented, especially type 2 diabetes. And lifestyle can actually protect us from developing diabetes. So is the saying that genetics load the gun, but lifestyle pulls the trigger. I'm using this because initially I said you might be coming from maybe a family that has the history of diabetes or increasing age. There are those factors that you cannot change. But yes, you cannot change them. But what is going to determine whether you have diabetes or you don't have diabetes? It's lifestyle. So I think it's important that we really try to live a healthy lifestyle. And also, I want to say diabetes, everyone, an individual, family, community, government, you have a role to play in order to address the rising burden of diabetes. Don't leave it to somebody else. Everyone has a role to play in this, yeah.
Thank you so much, Dr. Gonzi. With that said, we've come to an end of this Facebook Live conversation. As Dr. Gonzi mentioned, we all have a role to play. So share this conversation with your loved one, with your community, and with everyone out there. Until next time, it's goodbye.